Saat Farkı'ndan merhabalar. Her hafta farklı ülkelerden konuklarla farklı perspektiflere yer vermeye çalışıyor. Dünyayı Ekotürk ekranında buluşturuyoruz. Bu hafta biraz Covid salgını gölgesinde küresel sağlık politikalarını konuşacağız. Ülkelerin Covid'le mücadele performansı, yapılan hatalar, aşı dağıtımındaki sorunlar, dünyada aşı karşıtlığı gibi konuları uzmanından dinleyeceğiz. ABD'deki Duke Üniversitesi'nden Küresel Sağlık ve Kamu Politikaları Profesörü Gavin Yamey bizlerle. Welcome, Professor. Thank you very much for your time.
Thank you for having me.
Thank you very much. Well, Professor, I have a lot of questions to ask, and we have a limited time. So I want to start, first of all, with a little bit, maybe you can tell us some good news. We need to hear some positive news. So I want to ask you, it was all about restrictions, lockdowns in the past 2 years. But now with new variants like Omicron, countries seem to be more relaxed. So are we close to the end? Will the pandemic become endemic anytime soon? And if yes, what will happen next?
I mean, the good news is, of course, we have an extraordinarily safe and highly effective vaccine. And if we can vaccinate the vast majority of the world, my infectious disease colleagues, epidemiology colleagues say that we're going to need to vaccinate somewhere around 90 or even 95% of the world, then we can turn this pandemic into something that's akin to a cold or flu, something that does not give these awful waves of hospitalizations and deaths. Vaccines are astoundingly effective at preventing hospitalization and death. The folks who are sadly dying today, hospitalized and sick in the ICU, are much, much more likely to be unvaccinated. So vaccination is our way out of this pandemic for sure. Meanwhile, we now have treatments that hopefully will become widely available, in which if you catch the disease early and take this drug, it can stop you from being hospitalized or dramatically reduce your chances. So we're going to be moving into a hopefully post-vaccine antiviral world. Right now, of course, almost nobody in low-income countries is fully vaccinated. And that is our biggest challenge.
Yeah, we will talk about that more. I will come to that vaccination. But before that, I will ask you about how the pandemic was managed or mismanaged globally. Which countries managed really well, which countries failed, and what were the common mistakes? And maybe a follow-up question. There are some studies suggesting that authoritarian regimes were better in dealing with the pandemic compared to democracies. For example, you know, China has this zero-case policy. Some say the opposite. So what do you think?
So it's a very good question, and it's something that we're going to have studies for many years to come to try and understand which countries, you know, did the best at protecting people from death. It is certainly the case that you can look across the world and see that some nations have had mass death events, that places like the US and the UK and Brazil and other nations have had astoundingly high death rates in terms of, you know, cumulative deaths per million people. And there are clearly countries that averted these mass death events. And we are going to be trying to tease apart the reasons for this relative success for many years to come. But there are probably going to be some common principles in which countries did well and which countries did devastatingly poorly. And I would argue, and there is some early literature now to bear this out, that in many ways, countries that had previously experienced pandemics, particularly SARS, they had a memory of that pandemic. They had playbooks in place. They were ready and they took it very seriously very early on. In other words, in January of 2020, when the World Health Organization told all nations to get ready it said to every single nation that this virus is coming and you should get ready and you should identify every case, isolate the case. You should identify people who have been exposed and quarantine them. You should support people in quarantine and isolation. And you should be fast and act now and act rapidly. I think countries that had leadership, that had good communication with citizens, I think leaders that engaged the community and engaged citizens and communicated well, and adopted some of the sort of basic principles of pandemic management, have ended up avoiding these kind of mass death events that we've seen tragically in places like the UK, the US, and Brazil. So you can see, you know, much of kind of the Pacific, Southeast Asia, there are countries that have kept death rates very low. New Zealand, Australia, South Korea, Japan, and others.
I see. Professor, school closures have been one of the most debated issues during the pandemic. So supporters say the safety of children comes first. Others say schools should remain open no matter what. So what do you say from a public health perspective?
Yes, I think that the science is quite clear on schools and school safety. In fact, the science has been known for a long time. There are measures, science-based, evidence-based public health measures that you can put in place in any building. There's nothing unique about a school, right? Any building, any office, any school, there are measures that can be taken to protect people. That includes ventilation and air filtration. We know that the virus is transmitted through shared air, particularly if you're close to people. So we know that distancing works. We know that masking works, particularly high filtration masks. And now, of course, we have vaccination, including vaccination of children. So our kid is in-person school. He is 6. He is fully vaccinated. The school upgraded its ventilation. There is a HEPA filter in every classroom. There is a mandatory indoor mask mandate. The teachers are vaccinated. In my view, that's the full suite of protections. And he, touch wood, has managed to be in school, actually in school and prior to that in daycare since June 2020. So it can be done. The tragedy, of course, is that in many places these investments have not been made, and it is unconscionable that 2 years into a pandemic there are still some schools and still some areas, some jurisdictions that haven't put these measures in place, and it's very hard to keep schools open without these sorts of public health protections.
I see. Well, another highly debated and controversial issue is vaccine mandates. As you know, WHO said it should be the last resort. And countries have different policies. Politicians, scientists, ordinary people have different views. Personally, I am also, to be honest, confused. So I wonder your opinion, Professor. Should governments mandate COVID vaccines, and how to decide between public health and personal liberty?
Yeah, it's a very good question. And as you have already said, this is a very legitimate and very live debate. And I don't think it's a question of saying, oh, there's one right answer and then there's one wrong answer. We have to keep in mind that over 100 countries already have some kind of vaccination mandate. So mandates are a part of our life. Our kid can't go to school unless he's had his childhood vaccines. Many, many schools you can only attend if you've had your childhood vaccines. I joined Duke University 6 years ago, and you cannot work at my hospital, my university, unless you have a flu vaccine. So mandates are a part of our life. Lawyers and ethicists and legal scholars have very clearly stated that vaccination mandates are ethical, are legal, and are rights-based. And of course, you mentioned the WHO. They said very clearly that immunization is a human right. We have a right to be vaccinated. But as you said, the WHO also says it should be a last resort. Of course, we would love to be able to see the community embracing vaccination. And I think that that should always be the first approach. And in many cases, you can achieve astoundingly high rates of vaccination through information and communication and education. And we should obviously never, shame people who aren't vaccinated, but give them information, continue to answer their questions. But as you said, there are places now that are adopting COVID-19 vaccination mandates, and I can't argue with that. We have one where I work. I have to have a COVID-19 vaccination. Our employer, my university, has said, really, you need to protect yourself, you need to protect your colleagues, you need to protect patients. And that's why so many, hospital systems, health systems, and in some cases companies are adopting vaccination mandates right now.
Professor, as a follow-up question maybe on this, there's a strong vaccine hesitation all around the world, in Turkey also, in the US as well. So we usually tend to think the opposite, but some studies, many studies actually show that vaccine hesitation is a major problem, mainly in high-income countries with more educated people. What are your observations and what are the motivations behind this anti-vaccine movements? And of course, what to do, how to tackle with this.
It's a huge challenge, particularly where I live. And as you just said, actually, the research is quite clear that the desire to get vaccinated in surveys around the world is higher in low and middle income countries. So you're absolutely right. Vaccine hesitancy rates tend to be higher in wealthier nations. Here in the US, I think it's a very good example. There is, sadly, a terrible politicization of vaccination here. And right now, the strongest predictive factor of whether you get vaccinated is whether or not you voted for Trump, for Donald Trump. So unfortunately, it has now become kind of a part of, conservative and Republican identity to be vaccine hesitant or to even oppose vaccination. And we're going to have leaders on the right, conservative, Republican leaders, help us to reach Republican communities, to dispel some of the myths. If you turn on Fox News, our right-wing television show, 24 hours a day, they are spouting, peddling nonsense about vaccines, horrific misinformation and disinformation, as if they are trying to persuade people not to get vaccinated. Yeah. The irony, of course, is that Fox News, the company, has a vaccine mandate. Its employees have to be vaccinated or show a negative test before they come to work. So, there is a lot of hypocrisy around this issue right now. And I think there is also, of course, deliberate campaigns by large anti-vax organizations. There are 12 particularly large ones. They've been called the Dirty Dozen. And they prey on people's fears. They are monetizing this issue. They are asking people for donations. It is part of a sort of an anti-science movement, if you like, anti-science aggression. And the reality is, the result of this anti-science aggression is that people aren't getting vaccinated and they're dying from COVID-19. So we have to do better at countering these groups, at tackling disinformation, at realizing that there's an information war out there, and public health has been slow to realize that and slow to counter it.
Yeah, I was going to ask also that, Professor. You touched upon the misinformation, and scientists are not only fighting against the pandemic itself, but also, as you mentioned, the infodemic. And of course, there's a massive misinformation, particularly about vaccination on social media. And, conspiracy theories spread much faster than scientific facts most of the time. But also, Professor, I want to ask your honest opinion. Scientists were divided on some very core issues, from protection of masks to restrictions to vaccine efficiency. So I was wondering, Do you think mixed and sometimes even conflicting messages from scientists also contributed to this infodemic?
So I want to just challenge you on this point. Actually, much of the science is not controversial. We know what the virus is, we know how it is transmitted, we know the evidence-based and science-based tools, including vaccination, masking, distancing, that reduce transmission. And in fact, what the disinformation folks want you to believe, what the COVID denialist folks want you to believe, what the natural immunity enthusiasts and the Great Barrington Declaration folks want you to believe, is that there are, two sides to the virus. And that, I really want to challenge that. That is not the case, that most public health science, not all of it, as we've already talked about today, there are legitimate debates about things like, vaccination mandates and so on. But there is a body of science about this, how this virus behaves, that is not contentious. And you probably saw a really astounding paper published recently that I think is going to turn out to be one of the most important studies for understanding the management and mismanagement of this pandemic. And it was a study that looked at media representations of the virus of COVID-19. And what it showed was that a very tiny band, a little group of fringe scientists, were able to dominate the media discourse with great success and make it seem like there were two sides. And that discourse got in the way of public health measures. So I really would like to challenge you on this notion that there were two sides to the virus. The virus doesn't care. The virus will be the virus. It will find people who don't have immunity and infect people. It will behave as it behaves. The science on how you interrupt transmission, how you prevent people from getting sick, the science is, the body of science is largely, as I said, not entirely, is largely accepted. So I think that that's a very important point to make.
I see. Challenge accepted, Professor. Continuing on vaccination, there are some also serious distribution issues and inequalities around vaccination. And unfortunately, the vast majority of vaccine doses are still in high-income countries. And it is more like a charity from them to the poor countries. Vaccine inequality is costing lives for developing countries, and particularly Africa. We've seen it. So did all the efforts fail, or there were not enough efforts at all?
So there have been two big problems. The first is that rich nations and powerful vaccine companies have blocked low and middle income countries from making their own doses. And that's unconscionable. Low and middle income countries have the right to make their own vaccines, but the rich world has blocked them. And at the same time, you mentioned donations. Of course, rich countries should have been donating doses. They have excess doses that they're throwing away, that they haven't been able to use, around 1 billion excess unused doses by the end of last year, many that ended up in the trash. And they have been incredibly miserly and have not been willing to share enough doses. So they have been blocking and hoarding. So no, I think this is an example of the rich world behaving at its very worst, at its most greedy and its most immoral. And the reality is that that means the pandemic is going to go on for many years. Most vaccine experts, infectious disease epidemiologists, think that we're going to need to vaccinate somewhere around 90 or 95% of the whole world to end this pandemic. And I don't see that happening anytime soon unless we change this hoarding and blocking behavior.
Professor, I wonder also your opinion on patent waiver. As you know, there were some campaigns initiated by India and South Africa to temporarily lift some intellectual property rights for vaccine in order to boost global supply. On the other hand, of course, companies are making exceptional profits, as you also touched upon. So what's your take on this patent waiver for vaccines during a serious pandemic?
Yes.
You think that will be a solution?
I am highly supportive. I think that any time that there's a pandemic, there should be a patent waiver on pandemic vaccines and other tools. I think that's one lesson from COVID-19 that I hope we take forward, that in a future pandemic, when a public health emergency of international concern has been announced, i.e. we have a pandemic on our hands, I think the patents, the intellectual property on these medical countermeasures, vaccines, diagnostics and tools, have to become a global public good. They have to be shared. We need what's called a people's vaccine. A people's vaccine is a three-legged stool. The first leg is the patent. You have to share the recipe. The second tool is called tech transfer. In other words, having the patent alone isn't enough. You have to understand the technology. If the patent is the recipe, tech transfer is like a chef coming to your kitchen to explain how you use the recipe. And the last, of course, is globalized manufacturing. We need countries all around the world to be able to manufacture the vaccines themselves. We have to move away from this trickle-down manufacturing idea where rich countries manufacture the vaccines and then perhaps donate a few doses here or there like crumbs from a rich person's table. We need bottom-up manufacturing as we go forward.
I see. Unfortunately, very little time is left, Professor. So, but you said this was the first lesson, number one lesson. What are the other lessons, I wonder, that we learned, hopefully we learned from this pandemic?
I mean, clearly there's a hope that we might have some kind of a global pandemic treaty going forwards. But the issue, of course, is there was huge variation in whether countries actually abided by international health regulations. Some countries ignored the WHO's guidance, others adopted it. And that's a problem that we're going to have to, solve going forwards. Clearly, we are going to have some kind of agreement on how we share vaccines in a future pandemic. We cannot have the rich world buying up the entire supply immediately and leaving poorer nations behind. That is unethical, immoral, unjust, and it leads to people dying. So we're going to have to find some agreed way going forwards for us to distribute vaccine doses more fairly. I was involved very early on in an advisory group, an unpaid academic advisory group, that advised an initiative called COVAX that tried to push for global vaccine sharing. And I think COVAX had the right idea. The idea was we should vaccinate 20% of the population in every nation first. High-risk people, elderly people, medical people, health workers, and other essential workers. If we had done that in all nations first, we would have been able to dramatically reduce the death rate. So we're going to need to think very carefully and have these, playbooks ready on vaccine sharing, on vaccine manufacture, on abiding by the international health regulations to avoid the kind of devastation that we've seen with COVID-19.
Yeah, and hopefully we will not have another pandemic anytime soon, Professor.
I hope I don't need to come back on this show to talk about the next pandemic.
Hopefully. Thank you very much, Professor. Thank you so much for joining us.
Thank you very much for the invitation.
Stay healthy. Evet, Saat Farkı'nı bu hafta da böylelikle noktalamış olduk. Bu hafta biraz salgın konuştuk. Kamu sağlığı politikalarına baktık. Ülkelerin salgınla mücadele performansına, dünyada aşı karşıtlığına, aşıların dağıtımında yaşanan sorunlara bu konuları uzmanından dinledik. Amerika'daki Duke Üniversitesi'nden Profesör Gavin Yamey bizlerleydi. Önümüzdeki hafta yine farklı bir konuyla, farklı bir konukla görüşmek üzere. Hoşçakalın.